Regional anesthesia is a great option for procedures where you only need to numb a specific part of the body, and the patient can remain awake and alert during the procedure. It provides a balance of pain relief while maintaining a lower risk profile compared to general anesthesia. Here are some common scenarios when regional anesthesia might be used. 1. Lower body surgeries. 1. Spinal anesthesia, or epidural anesthesia, is often used for surgeries involving the lower half of the body. 1. Examples include cesarean sections, C-sections, hip replacements, knee surgeries, pelvic surgeries, urological procedures, e.g., prostate surgery. 2. Regional anesthesia numbs the lower body, allowing patients to remain conscious while still being comfortable and pain-free. 2. Surgeries in the upper body. 1. Brachial plexus block, a type of regional anesthesia, can be used to numb the arm and shoulder area for surgeries like shoulder surgeries, hand or wrist surgeries, upper extremity fractures, breast surgeries. 3. Labor and delivery. 1. Epidural anesthesia or spinal anesthesia is commonly used during labor to help manage pain while allowing the mother to be awake and alert. 1. It can be used during childbirth to provide relief from contractions and pain during delivery without affecting the baby. 2. Combined spinal epidural, CSE, anesthesia combines the benefits of both spinal and epidural blocks for quicker pain relief. 4. Outpatient surgeries or minor procedures. 1. Regional anesthesia is often used for less invasive procedures, especially if the patient is healthy and the surgery is expected to be relatively short. 1. Examples include carpal tunnel surgery, varicose vein treatment, knee arthroscopy, certain orthopedic procedures on the limbs. 5. When general anesthesia is not ideal. 1. Regional anesthesia may be the preferred option when general anesthesia carries more risk due to the patient's health or medical conditions. 1. For example, for a patient with respiratory issues or heart problems, regional anesthesia might be a safer choice. 2. Obese patients may also benefit from regional anesthesia for certain procedures, as general anesthesia might carry increased risks. 6. Pain management after surgery. 1. In some cases, regional blocks are used for post-surgical pain control. 1. Epidural analgesia or continuous nerve blocks, e.g., femoral nerve block for knee surgeries, can provide prolonged pain relief while reducing the need for oral pain medications after surgery. 7. Minimizing recovery time. 1. Regional anesthesia usually allows for quicker recovery times compared to general anesthesia because the patient isn't as deeply sedated. 1. After a regional block wears off, patients often feel more alert and ready to move around more quickly. 8. Patient preference. 1. Some patients might prefer regional anesthesia because it avoids the risks associated with general anesthesia, and they remain conscious and aware during the procedure. 1. For some, this is less intimidating than being put to sleep completely. 9. Procedures with a shorter duration. 1. For procedures that are expected to be brief and localized, regional anesthesia can be a good choice because it effectively numbs the targeted area without requiring the deeper sedation of general anesthesia. Considerations. 1. Patient's health. If a patient has certain medical conditions, e.g., issues with the spine or nervous system, regional anesthesia may not be an option. 2. Procedure type. If the surgery is complex or involves a large area of the body, general anesthesia might still be necessary. 3. Duration of surgery. Longer surgeries may still require general anesthesia, but regional anesthesia is often chosen for procedures expected to last a shorter time. Types of regional anesthesia. 1. Spinal anesthesia. Involves injecting a local anesthetic into the fluid around the spinal cord to numb the lower body. 2. Epidural anesthesia. Involves injecting anesthetic into the epidural space around the spinal cord, often used during labor or for lower body surgeries. 3. Nerve blocks. Involve injecting anesthetic around a specific nerve or group of nerves to block sensation in a specific area, such as an arm or leg. 4. Peripheral